Good evening, everyone. By a show of hands, who here is afraid of the dentist? I was at some point, but I've chosen dentistry as my passion. A smile is the prettiest thing you can wear. I chose this quote because I want you to think differently about teeth. When talking about dentistry, I mean appearance, because first impressions mean everything, right? My name is Jocelyn. I will get to elaborate about what goes on behind the scenes of your dental visit. I went to Carrington College and graduated in the summer of 2013. I have worked at my dental office, Smile Today, for almost 4 years. I've done almost 10,000 fillings and over 3,000 extractions. Due to my work experience, I feel that I've mastered dentistry in all aspects. Therefore, I can elaborate. In the marvelous world of dentistry, there are different types of dentists, different types of procedures, and dental staff that surround your dental office. To begin with, there are multiple dentists and different types of dentistry. All dentists are considered general practitioners, meaning they can do basic dentistry examples, crowns and fillings. Now, if you need extensive treatment, there are specialized dentists that, specialized dentists in extractions called oral surgeons, dentists who clean out the nerves that are called endodontists, and those who make sure that your gums are healthy called periodontists. Prosthodontics are the dentists who specialize in the making of removable or fixed appliances, examples, dentures and partials. Dentists who focus on straightening and alignment of teeth are called orthodontists. And finally, those who take care of our little ones are called pedodontists. There are many more, but Dr. Friedman, a well-known successful dentist, wrote an article for WebMD in 2006, and these are the 7 that he spoke of. If you haven't been to the dentist, there are procedures mentioned above that you might not know what they are. Not all teeth are the same, meaning they might need different type of treatment, okay? I'll get to fill you in on a few, unintended. That brings us to the life cycle of a tooth. We start off as a natural, healthy tooth, meaning it hasn't been touched by a dentist. What follows is a sealant, which is the first layer of protection. After that, a small cavity is present, and you gotta do a small filling, okay? If a filling fails, then you have to replace it. And by fail, meaning you have a new cavity underneath that small fill. Well, third time's a charm. Now you got another one. That filling gets replaced with another filling, granted, if less than 50% of healthy tooth structure is gone, a crown is recommended, because possible fracture due to the majority of the tooth being gone, leaving the tooth fragile. Okay? A brochure that Delta Dental, a insurance company, says that ceramic crowns can last over 10 years, depending on the time frame, if you've reached it or if the crown looks iffy. My recommendation would be to consult with your doctor just to make sure that that crown doesn't need to be replaced, or if it does. Now keep in mind that this is just an idea of what your tooth can possibly go through. It doesn't necessarily mean that this is what your tooth needs. Sometimes you can skip depending on the severity as well. Okay? What follows is a root canal. Once a root canal has been done, and if the tooth is giving you problems, then we do an extraction. Well, now you have a hole. Luckily, you have options for replacement depending on what tooth was extracted and on the site. Implants can be placed or a bridge, like I said, depending on the site. Now that I've explained the the dentist and procedures, let's get the rest of the office involved, okay? Not only is the dentist crucial in the office, the rest of the staff is too. Your dental needs cannot be reached without an assistant, okay? They need heroes too. That's where they come in. Hygienists are the practitioners who clean your teeth, and that wraps up the clinical team. Now, the office will not run without an office manager, the OM. And there's also a benefits coordinator who pulls out your information and gives you a quote to aid how to address your dental needs. Lastly, you can't forget who reminds you of that dental visit, the receptionist. Reminder, not all offices are the same, okay? And so far that covers the majority of the staff members. There could be more or less. Thank you.